Welcome back to the channel, and today we're covering the number one reason why patients end up in our office. Now, disc pain is the most common reason for low back pain, accounting for 40% of all pain in the lumbar spine. And it's likely that at least 80% of people are going to experience lower back pain in their life. So how do you know if you have a disc pain from bulging discs? And if you do, what is the best way to help yourself get out of pain? And what should you do if exercises such as these aren't working? Hi, I'm Dr. Ryan Hislop. I'm a chiropractor in Australia, and today I'm going to show you what a disc bulge is to begin with and tips to stop this happening in the first place. And if you are unfortunate enough to experience a painful bulging disc, what is the best thing to try at home to get relief? Now, depending on what brought you to this video, I've just put some timestamps in the video here to help guide you to the information that you're looking for. So firstly, how do you know if you have a painful bulging disc to begin with? As I mentioned before, 40% of pain in the low back is due to a disc, but 30% are due to facet joints and 22.5% are due to sacroiliac joints. So although this presents a diagnostic challenge for the health professional, there are a few key signs and symptoms that we look for. And this is critical because a lot of people are going to have bulging discs but not have any pain without them. So simply taking an MRI of someone will not tell us if their disc is causing that pain or not. The first hint it may be a disc is that disc pain tends to be more axial or more in the center of your spine. The second hint is that disc pain tends to be worse when sitting down for long periods, and particularly when going from sitting to then standing. Now, the third hint is signs of neural tension. Now, this is where nerves passing closely behind the disc can be irritated. People often associate this with sciatica or nerve pain in the leg, but this is not always the case. And a quick test you can do on your own is known as a slump test. So when sitting, gently extend one leg, bring your chin to your chest and bend slightly forwards. If this evokes low back pain or leg pain, an injured disc is high on the probability list. This is because the anterior thecal stack can be irritated in this position by inflammation around the posterior disc lesion, like a bulging disc or protrusion. And finally, the most predictive sign that a bulging disc is at fault is that if you have leg pain, you can move in certain ways we call directional preference, like leaning back into extension, and you do this repeatedly and the leg pain centralizes into your low back. This is almost certain that the disc is the cause of the pain if this occurs for you. So you've determined that a bulging disc is the most likely reason for your pain. I'm going to run through 3 simple exercises that you can use to get relief and assist in helping your disc bulge heal. My number one exercise for getting relief from disc pain is the 90-90 position. This can be done in bed, at home, at work, anywhere where you can lie down. Now, to do this, find a chair, lay on your back with your lower legs at horizontal on the chair. Your knees and hips should be at 90 degrees. Now, most disc bulges should instantly feel better in this position because what it's doing is effectively decompressing the disc in the low back. To begin with, you're lying down, so there's less force from gravity acting on the discs, less compression. But in addition, having your legs in this position relaxes the hip flexor muscles, which, even when you're laying flat, can compress the discs. So being in this position, your legs up negates that and maximally decompresses the discs you have in your low back. I've found that for some patients that because sleep can be so uncomfortable with a disc injury, they can lay on their back in bed with a few pillows or even on their side with a pillow between their knees and their hips with their knees bent. This is a position that you can remain for 20 minutes at a time if necessary, but it's important to get up and move about in between. Usually after being in this position for a while, it can be a bit uncomfortable to get moving again as you slowly put weight back through the discs. My second go-to exercise is the hip flexor stretch. Now, you may need a partner to assist you with this one. And as I mentioned, with laying flat, still having a compressive force through the discs due to the hip flexors, this stretch aims to reduce that tension through the hip flexors, thus reducing the compressive forces. These muscles are often short and tight due to the amount of time we spend sitting. So with this one, lay on your back, pull one knee up towards you, and then have someone assist you by placing pressure on the leg that's flat. Now, very gently, about 10% effort, lift the flat leg up and hold gently for 10 seconds. Then relax and pull the knee up a little further and repeat. And I usually do this 3 times on each leg. My third go-to exercise depends on whether you experience centralization with pain with certain movements, and usually this is with extension movements. You can do this sitting, standing, or even lying on your tummy. With this one, it's all about repetition and being gentle, and if this does not cause a reduction in leg pain, for instance, don't continue doing it. Slightly lean backwards till you feel a slight increase in pressure in the low back, then come back up straight and repeat 10 to 15 times. And I'd suggest trying this every 30 minutes. Sometimes even these exercises are not sufficient to resolve the pain from a disc bulge. And if this is the case, this is where spinal professionals such as a chiropractor will be the next person to contact. They can firstly diagnose the issue, determine what type of treatment is going to be most effective for you. If they can't help, where's the most appropriate referral to get this issue sorted out? So if you found this a helpful video, please click the like button below. And if you wish to continue to see more videos like this, click subscribe and toggle the bell. Finally, if you have any questions about this exercise, please leave a comment below and I'll reply shortly.